If you have a pinched nerve in your neck and you are feeling that tingling, numbness, or shooting pain traveling down your arm into your hands, you're in the right place. In this video, I am going to walk you through 3 specific nerve glide exercises that target the exact nerves that cause these symptoms. We are going to do these together, so follow along with me step by step. Before we jump into the exercises, I want to show you something most people completely miss out about how an irritated nerve is actually behaving. Because if you don't understand this, these exercises, they won't work the way you want them to. Hi, I'm Dr. Tam, chiropractor here in San Jose, California. A pinched nerve in your neck is called cervical radiculopathy. Now that is a clinical term for what happens when one of the nerves exiting your cervical spine from your neck gets compressed or irritated. That compression disrupts the signal the nerve is supposed to send, and that disrupted signal is exactly what creates the tingling, the numbness, and that burning or shooting pain you feel traveling down your arm. Now here's something important. The 3 nerves we are targeting today, the median nerve, the radial nerve, and the ulnar nerve, all originate from the same network in your neck called the brachial plexus. Now they branch out from your cervical spine and travel all the way down your arm into your hand and fingers. So when there is a problem in your neck, symptoms can show up anywhere along the path where those nerves travel. That is why you may feel some tingling in your fingers, even though the problem starts from your neck. Nerve glides, also called nerve flossing, are specific movements that mobilize the nerve through the surrounding tissue. Instead of just stretching a muscle, these exercises, they actually move the nerve back and forth along its path, the same way that you would when you floss between your teeth. This does 2 things. First, it helps to reduce inflammation and tension around the nerve. Second, it helps to restore the nerve's ability to glide freely through the tissue the way that it's supposed to. When the nerves can move freely, symptoms reduce. These are not random exercises. They are anatomically specific. Each glide targets a different nerve, which is why we are doing all of the 3 today. One important note before we begin. If any of these movements cause your symptoms to increase or push pain further down your arm, stop the exercise immediately. The goal is relief, not more symptoms. And if your symptoms begin moving back towards your neck during these movements, that is actually a good sign. And it means the exercises are actually working. We are starting with the median nerve glide. Now the median nerve travels from your neck down the front of your arm, through your wrist, and into the palm of your hand, your thumb, and your index finger. Also your middle finger as well. Now, if your tingling or numbness is in these fingers, this exercise is especially important. How do you do the median nerve floss? Very simple. What I want you to do is this, and follow along with me. You're gonna sit up nice and straight, and you're gonna take the palm of your hand, and you're gonna place it as if you're pushing down into the floor. Okay, so shoulder and palm down into the floor, and the fingers are facing back. Another thing I want you to remember is the fingers. We want to have them open, not closed like this, but open. So open, fingers pointing to the back. You want to depress the shoulder and push your hand down into the floor. Now, in this position right here, you're going to lift your arm up about 45 degrees, and already right there, you will most likely start to feel a little bit of a pull on that median nerve. Now, if this is good enough and you feel that stretch, fantastic. Or we can start flossing that nerve. And the way that you do that is this. So remember, the palm is facing back, fingers back. You're gonna tilt your head to the side. And as you tilt your head to the opposite side, I want you to then bring your palm forward. Okay? So we're gonna do this to the side, palm forward, head to the opposite side. And you're gonna do this motion about 10 to 15 repetitions, and you can do this 3 to 4 sets You could do this every day until that numbness and tingling starts to go away. And you can do that actually for, the next week or so, right? But the key is you want to go just to the point where it's comfortable, right? So if you feel increased numbness, increased tension in that area, best rule of thumb is to stop. The second exercise is the radial nerve glide. Now the radial nerve travels from your neck down the back of your arm and into the back of your hand, the back of your thumb, your index finger, and your middle finger on the back side. If your symptoms are on the outer or back side of your arm or hand, this is the exercise that targets those symptoms directly. So the way that you do it is like this. Opposite from the median nerve. Now, median nerve, your hand is going back, right? With the radial nerve, we're going to have the hand coming forward. Again, make sure the fingers are splayed out like this, and we're going to depress down into the floor, fingers facing forward this time, sitting up nice and straight, shoulder down, and in this position, we're going to go again, 45 degrees. Now at the 45-degree mark, what we're going to do is, again, if this is okay and you feel a stretch, that's all you need, fantastic. But if we want to floss the nerve, the way that we do that is this. You're going to then bend your head to the side, okay? Keeping the hand in this position. As you bend the head to the opposite side, you're going to open up the palm, facing back, okay? Like this, bend, and then bend to the other side, bend in, palm forward, bend to the other side, palm back. Again, you can do this 10 to 15 repetitions like this, 10 to 15 repetitions. You can do 2 to 3 sets. You could do this daily. Remember, daily up to 1 to 2 weeks until the symptoms kind of go away. Hopefully that helps. Any questions, let me know. The third exercise is the ulnar nerve glide. Most people know the ulnar nerve as the funny bone nerve. Now it travels from your neck down the inside of your arm, wraps around the inside of your elbow, and runs all the way into your ring finger and little finger. If you're tingling, numbness, or pain is in these 2 fingers or along the inside of your forearm, this exercise targets those symptoms precisely. I'm going to show you 2 different variations of how to do the ulnar nerve floss, and you can just choose whichever one actually works best for you. So the first one we're going to do is you're going to put your arm forward like this and go ahead and bring your pinky and your thumb together, kind of making like an A-OK sign, okay? So you're going to bring the pinky and thumb up to your eyes, going backwards, and then you're going to hold that position like this, okay? And then you go ahead and bring it back forward. And then you're going to come back like this, go back over your eyes, and then back forward like this. You're going to really feel this. I mean, I feel this quite a bit. Just bringing that back, going over your eyes. And so your finger's actually going back, and you're going to hold that for a second, and then come on back through here like that. Okay, so that's one variation. The next thing you can do is something similar. We're going to go like this, still sticking with the pinky and the thumb, and you're going to bring your arm to your chin, have your head in this position here, and just simply bring the arm out and then back in. Arm out, back in. And if you notice, while I'm moving, it's not this rapid motion. This is a slow, controlled flossing movement. I want you to feel that stretch as it goes through, okay? So another variation that you can do is in this position here, you can actually, as you're bringing the hand in here like this, you can actually have the head up and then back in, okay? Head up, look up to the ceiling, and then back in. Now, if that doesn't do anything for you, then you can do the opposite. You're gonna go head in, out, in, out. Whereas the other one was looking up, right? This one's going in. So 2 different ways to do that. Again, what we're looking for is a decrease in that numbness or tingling. You may have a little increase, a subtle increase as we're doing it, and that's normal, but don't push into pain, don't push into more pain, don't push into more numbness and tingling. Work your way slowly into it. 10 to 15 repetitions. You can do this, 2 to 3 sets, and over a period again of 1 to 2 weeks until those symptoms go backwards or lessen. Now that you know all 3 nerve glides, here is how to actually use them the right way. First, match the exercise to where symptoms are felt. If tingling, numbness, or pain is felt in the thumb, index, or middle fingers, focus more on the median nerve glide. If symptoms are more on the back of the hand or outer arm, the radial nerve glide becomes more important. If symptoms are in the ring finger or little finger, or along the inside of the forearm, focus on the ulnar nerve glide. If symptoms are only on one side, focus on that side. If symptoms are present in both arms or hands, perform the exercise on both sides. Pay close attention to how the body responds. A mild stretch or light tingling during the movement, can be normal. That is the nerve being mobilized. But sharp pain, increasing intensity, or symptoms traveling further down the arm is a signal to stop that exercise. These movements should always stay within a comfortable range. More intensity does not mean better. In fact, forcing the movement often can make the symptoms worse. Now here is how often to do them. Perform all 3 exercises once per day. Morning, is usually the best time, especially if symptoms are more noticeable after sleep. Complete 10 repetitions for each exercise for 3 sets. As symptoms begin to improve over the next 1 to 2 weeks, these can be reduced to 3 times per week as a maintenance routine. Consistency is what drives change here. Nerve mobility improves gradually. Some people feel a difference within the first few sessions, while others will notice steady improvement over 1 to 2 weeks. Now here is the biggest mistake people make when they do a nerve glide. They go too fast. They force the movement. They treat it like a regular stretch and actually push until it hurts. Nerve tissue is sensitive. It responds to gentle, slow, rhythmic movement. Force can create more irritation. Slow, smooth movement creates relief. Keep your movements calm and controlled. The nerve will respond. If you followed along with me today, you just gave your nerves of your neck and arm real targeted relief. These exercises work because they address the nerve directly, not just the muscles around it. A pinched nerve in your neck does not have to be a permanent problem. With the right exercises done consistently, your nervous system can heal. Your symptoms can reduce, and you can get back to living without that tingling and pain in your arm. If this video helped you, like and share it. It helps more people find this content who are dealing with the same symptoms you are dealing with. And be sure to subscribe to the channel if you want to discover more tips on how to protect your spine, understand your condition, and learn the treatments that help people get long-term relief. If you also get numbness and tingling in your arm at night and it's messing with your sleep, I've got a video for that too. It shows 7 simple ways to get relief and how to sleep better with a pinched nerve in your neck. Go watch that video next.